And now, here's the next edition of Applied Common Sense.
Hi, I'm Dr. Mitchell Perry, and today's topic is common sense. Now, when you think about common sense, you'll notice that common sense is too often very uncommon. And yet, you know what common sense is. What is it? Well, it's practical, it's rational, it's reasonable, it's prudent, and it reflects sound judgment. And some of your behavior actually reflects common sense. When you think about that, let's take brushing your teeth. You wake up in the morning, you brush your teeth, and it's good for you. It's common sense. Your teeth are clean, they're probably going to last longer, there's better hygiene, and it's a good thing. That's common sense. And yet, some of your behavior is actually void of common sense. If you think about it being void of common sense, what does that mean? That simply means sometimes it's dumb, or it's stupid, or, as we call it, it's insane. Albert Einstein talks about insanity, and he says insanity is doing the same thing with the same counterproductive outcome with the illusion that if you keep doing that same thing, you're going to have a different outcome. That's insane. That's insanity. And some of your behavior reflects that. For example, you only speak English, and you're talking to someone who only speaks Spanish. So what do? You speak English louder. That's going to work. Or if you really want to add some horsepower, add a Spanish accent to it. That seems to work really well. That's insane. Another example, you're obese. You're on high blood pressure medication. You have type 2 diabetes, and you're puffing at the top of a set of stairs. So what do? Well, you're lonely and you feel badly about yourself. So I'll tell you what, let's have a pint of ice cream. That'd be good. That's insane. Or you're $75,000 in credit card debt. You only make $50,000 a year. So what do? Well, let's get another credit card, shall we? Let's raise the debt limit. That's insane. And yet, if you think about it, many people do that. Many of you do that. We all do some common sense, and we all do some insanity. So here's the question. If you could figure out a way to live the rest of your life and have the rest of it be largely common sense or largely insanity, which one would you do? Think about it. The rest of your life, largely insanity or largely common sense? Well, of course, it's common sense to say, I'd like common sense. And the answer is that's right. The question now is, how would you do it? And the answer is, that's a good question. It is important to figure out how you do it. So the first thing you do is think about your choices, think about your behavior, and decide when you're about to do something, does this make any common sense? If the answer is no, figure out a way to change it. Moreover, I encourage you to listen to all these YouTube videos that I'm providing, simply because there are lots of common sense ideas, which, as you know, are very uncommon. Moreover, consider going to my website, because there's a bunch of additional ideas as well. So think about it once again. Practice common sense, and you get good results. Practice insanity, and you practice brain damage. So let's opt for common sense. I'm Dr. Mitchell Perry, and that's today's edition of Applied Common Sense.